wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. We're going to discuss the topic of heart disease, cholesterol, and statin drugs. As you are probably well aware, the leading cause of death in America is heart disease. Approximately 800,000 people every year in the United States have a heart attack. Somewhere on the order of 700,000 people each year die of heart disease. This is excluding strokes, other cardiovascular problems. So that doesn't mean all the 800,000 people that have a heart attack, 700,000 die of that, but over time, every year, approximately 700,000 people die of heart disease. So that tells you, if it's the leading cause of death, you ought to take an interest in how to protect your heart. So let's talk about what causes heart disease. If you ask the average conventional doctor or the average citizen, they're going to say, well, cholesterol causes heart disease, which is totally bogus. Heart disease is caused by inflammation of the coronary arteries. And those coronary arteries have a lining in them. It's called the endothelial lining. It's the lining of protein that lines the arteries in your heart that distribute the blood to the heart muscle. And when they become inflamed, the body doesn't like that. Think about taking sandpaper and scraping the top of your hand. It would be inflamed and it would ooze. When the coronary arteries become inflamed, the body doesn't like that. They want to heal it. And what the body does, it takes LDL, low-density lipoprotein, and it tracks with cholesterol, picks up cholesterol, and it Band-Aids the inflammation. So cholesterol is a bandage over the inflamed artery. The body doesn't want the artery to remain inflamed and then break down and you bleed to death. So it has a mechanism by which it patches the artery with cholesterol. Cholesterol didn't cause the inflammation. It's the treatment by the body to stop the inflammation and the bleeding. And what happens, then the body and the arteries absorb calcium into the cholesterol plaque to harden it, to give it integrity so it doesn't break down. Obviously, the problem with that can be as you develop more and more inflammation and the arteries become harder, you narrow the arteries, and then if you have a plaque that breaks down, it can float downstream, cause a clot, and block the artery, which leads to a heart attack, which is simply the lack of blood to the heart muscle, and the heart muscle basically has an anoxic event, no oxygen, and it kills that muscle or damages the muscle. So cholesterol is not the cause of coronary artery disease. Inflammation is. Now, what causes the inflammation? Well, heavy metals can cause the inflammation. Mercury amalgams, the mercury leaching into the system can cause inflammation. You may get aluminum from your cooking or packaging. You get aluminum. Cadmium, other types of metals you can get into your system, and those cause inflammation. A high sugar diet, high levels of sugar cause inflammation in the coronary arteries. And also, inflammation can be caused by bacteria that primarily come from gum disease and nerve roots that have been removed and with poor dental hygiene. And those bacteria have been found and cultured in the plaques in the coronary arteries. So if you don't have good oral hygiene, that's going to increase your risk of having heart disease. So it's very important for you to not have, we recommend no root canals. And the reason is because when you take the root out, you kill the tooth, and bacteria can get into that tooth, and every tooth has about 3 miles of tubules. Imagine that, 3 miles in one tooth. That's hard to imagine. That's how microscopic those tubules are. And bacteria get into there, and every time you chew or eat, that gets seeded into the bloodstream. These are anaerobic bacteria, and they go to the coronary arteries, and they cause the inflammation. So you want to clean up, get rid of any metals that you're exposed to, whether that's lead, whether it's mercury, or whether it's aluminum. And you want to make sure you have a low sugar eating program. That means low simple carbohydrates. And you want to make sure that you got good oral hygiene. Now, cholesterol is considered by conventional doctors as the bogeyman in heart disease, and it's not. I've explained to you it's a patch. Cholesterol is an essential molecule made by your liver. Your body makes cholesterol. What does it make it for? Well, every cell in your body the cell ring is made up of cholesterol. The nerves in your body have a nerve sheath called myelin, which is made up of cholesterol. Your hormones like testosterone and estrogen and progesterone and DHEA and aldosterone and cortisol are all made from cholesterol. That's the building block. Vitamin D is built from ultraviolet light coming in and hitting the cholesterol, and it converts it to vitamin D, which is so very essential for immune system health, brain function, as well as for cardiovascular function. Cholesterol also makes up 25% of the brain. Cholesterol is so very important for nerve function, not only in the rest of your body, but in the brain. So when you that emphasizes the importance of cholesterol. And by the way, you don't raise your cholesterol level through eating. That does not raise cholesterol. Your body makes cholesterol. Now, the conventional doctors say, and promoted by the pharmaceutical companies, low levels of cholesterol mean you're not going to get heart disease and you're going to live longer. Well, as a matter of fact, the studies have indicated people throughout the world, when they study people that live to ripe old ages in the 90s and 100s and 110s, when they measure their blood level, they have higher levels of cholesterol, somewhere in the range of 210 to 240, 250 even. They have higher levels of cholesterol, and their low-density lipoprotein is also robust at a good level, and they have low triglycerides. So what we have found too in studying individuals that take cholesterol, which takes people that take statin drugs, it lowers their cholesterol level. But we found that people with lower cholesterol levels below 180 have a increased mortality rate from all kinds of other diseases, not just heart disease, but from other diseases. So the mortality rate goes up. Your chances of dying increase when you have lower levels of cholesterol. And that totally breaks the paradigm that has been taught to us. I was taught in medical school, and that's been taught to doctors for the last 50 years and to the population. You've got to take your statin drugs. Well, statin drugs and cholesterol are very beneficial because, as I mentioned to you, by the way, those cholesterol drugs, anti-cholesterol drugs, the statin drugs can cause a host of health problems, and I wanted to describe those to you. But first, let me just reiterate the benefits of cholesterol. It helps neutralize bacteria and viruses. It protects against infections. It helps build your hormones. As I mentioned, testosterone, the other sex hormones, cortisol. It also helps protect against dementia. As I mentioned, cholesterol makes up 25% of the brain. And if you're taking a drug that's sucking cholesterol out of your brain, guess what you end up with? You end up with dementia, Alzheimer's disease, other neurological diseases from low levels of cholesterol. Also, cholesterol helps detoxify toxins in your body and chemicals and heavy metals. It attaches to them, and then they're excreted. It also helps you in the absorption of the fat-soluble vitamins, vitamin A, D, E, and K. And it's shown that people with lower levels of cholesterol have higher levels of depression, anxiety, and other even an increase of suicide rates. So statins in and of themselves can cause health problems by lowering your cholesterol level, which you need to function at an optimal level. One of the other things the statin drugs do is they not only do they block the enzyme in your liver that makes cholesterol, which is essential for good health, it also blocks the enzyme that makes coenzyme Q10, which is a very important molecule used by the mitochondria, your power plant within your cells, to make ATP, your energy molecule, your electrical energy molecule. So when it blocks coenzyme Q10, your mitochondria can't make the type of energy your body needs to function at an optimal level, so you become low voltage. And commonly, I have seen individuals that come to the Hotze Health and Wellness Center that have been on statin drugs, or friends I know that have been on statin drugs that go, gosh, I ache all over. I don't have the energy I used to have. I can't think clearly anymore. Well, 20% of the people that take statin drugs get body aches and pains, get cognitive disorders, and those are the ones that complain about it. Sometimes it's more subtle and you don't really appreciate it. You go to the doctor and say, well, your cholesterol is low. And you say, well, that's great. I'm going to live longer. Well, and as a matter of fact, as I mentioned, lower cholesterol increases your overall mortality rate. The overall mortality from anything from cancers and all other kinds of chronic diseases. So we don't want to lower the cholesterol. We like our cholesterol levels. According to the studies, the recent studies show that people with cholesterol between 200 and 240 have a longer lifespan than people that have lower cholesterols. And as a matter of fact, people that die of heart attacks, only half of them have elevated cholesterol, half of them have low cholesterol. So that tells you that cholesterol in and of itself is not the cause of heart disease. As a matter of fact, you can die of heart disease with low cholesterol. So what do you do to protect against heart disease? Well, one important thing to do is to eat a healthy, have a healthy eating program. That would include, I'm going to tell you, eating grass-fed, vaccine-free beef. Eat eggs. Your doctor's not going to tell you this. Eat butter. Eat organ meats. Make sure you get enough cholesterol and healthy fats. These are essential nutrients for your body. Also, eliminate those harmful oils that come in salad dressings, all the seed oils, canola, soybeans, corn oils that promote inflammation and oxidative stress. Cut out all these high, simple carbohydrates, the wheat, the corn products, the potatoes and rice. Minimize those, dramatically decrease those, because those are simple carbohydrates that convert to sugar. Sugar causes inflammation of the coronary arteries. And then make sure you're taking a good supplementation program, and there are several things that I recommend. One, if you're on statin drugs, you absolutely have got to be on coenzyme Q10, and we recommend to our guests 300 to 400 milligrams a day of coenzyme Q10 given as ubiquinol, and that's the active coenzyme Q10, ubiquinol. So, and if you're not taking statin drugs, I would take 100 to 200 milligrams a day. Also, make sure you take magnesium. And by the way, remember, coenzyme Q10 enables the power plants within your cells to produce electrical energy. And the electrical energy is conducted by the production of adenosine triphosphate, known as ATP. So when your mitochondria have adequate amount of thyroid hormone, which is the spark plug in the cell, and have adequate amounts of coenzyme Q10, you can produce energy. Guess what organ produces the most energy of the body and requires the most energy production? The heart. The weight of the heart, 20 to 30% of the weight of the heart is contained in the mitochondria. And other cells in the body, other organs of the body, only 2% is the mitochondria. So the heart cell beats 100,000 times a day. It's got to have, think about it, almost every second or even faster than that, the heart's beating over and over. That requires energy. And that energy comes from the mitochondria, and the mitochondria has got to have the building blocks to make ATP. And one of the building blocks is coenzyme Q10, ubiquinol. Also, thyroid hormone is very important. In men, testosterone. In women, your female hormones are very important in the production of energy within your cells. So these are very important. So if you want to live a long time, you want to live healthy, you want to have a health span. If you want to have a health span, you want to make sure you're producing energy within your cells. Make sense? I think it does. You want to produce plenty of energy so your heart functions at a normal energy level, and all your organs function, your brain, your kidneys, your liver, your muscles. You want to function at a high level of energy production. Magnesium is very important. It helps regulate heart rhythm. It relaxes the smooth muscles in your arteries, lowering blood pressure. It helps promote normal bowel function. It relaxes the muscles. It's very important, and I recommend somewhere in the order of 500 to 600 milligrams a day of magnesium, and we push it up to 1,000 milligrams. It can cause you to have loose stools, and you can back off of it if that causes you a problem. But it will keep your bowels clean. I'll guarantee you that with vitamin C. Also, there's an amino acid that's very important, and that's L-arginine. It's a derivative of an amino acid. You can take acetyl L-arginine, and that transports fats in the blood into the cell and into the mitochondria where they're burned to produce energy. So that's very important. D-ribose is a powder, and D-ribose is the building block of the energy molecule ATP. So you can take that every day, and that's important. Vitamin C also helps build collagen, which keeps the arteries of your body healthy. That's the protein in the bodies that line all your arteries, and that's key and very important. Collagen is also in our joints and in our tendons, so you need to have collagen. Those are, and besides that, a good vitamin B6, vitamin B12, folate are also important for a good, healthy cardiovascular function. If you want to stay healthy and well, you want to make sure that you have good levels of cholesterol in your body, not low levels. And the studies have shown, recent studies, and there's some older studies that have shown those individuals who have higher levels of cholesterol between 200 and 240 have a longer lifespan than those people that have cholesterol under 180. Now, when I was in medical school, upper limits, this goes back 50 years, upper limits were 240. Well, when the pharmaceutical companies got on this craze about lowering cholesterol, and they did that for one reason. It's a money maker. Lipitor and all the statin drugs have made literally hundreds of billions of dollars for the pharmaceutical companies. And then it creates all these side effects, the joint and muscle aches and pains, and you don't think clearly, you get dementia, you get neuropathies, It causes, by the way, another thing, the statins drugs cause liver disease. You've got to get checked by your doctor frequently to make sure your liver doesn't react to that, because statin drugs are a toxin and they have to be detoxified by the liver. And I can't tell you how many people I've seen that have been on statins. We do routine blood tests and we find their liver enzymes are elevated. We take them off statin drugs and they go back to normal. So the key for you to be healthy, eat a healthy eating program that I described, which would be a carnivore or ketogenic eating program. Make sure you get good healthy fats in your diet, eggs, butter, good healthy meats. Cut down on the carbs, the simple carbs and the sugar, and the packaged food, and eat plenty of green vegetables. That's so very important. And use oil. I really neglected to mention this. Oil is very important. Omega-3 fatty acids are very important. And you can get that from olive oil. You can get that from cod liver oil. And you get that from eating fish. And that's very important for brain function. It also keeps it helps prevents clotting in the blood. It keeps the blood, so think of it like it gives it a lube job. So the blood moves without a lot of friction and clotting up. So the good healthy oils are important. My eating program, I have an intermittent eating program, intermittent fasting. I eat one meal a day, eat dinner, and I'll have fish. If I'm out at my ranch, I eat grass-fed beef that hadn't been vaccinated, and it's not eating grass that's been fertilized. I don't want any of that in my system, and that's what we use when I'm out at the ranch. But in the city, I'll use fresh caught fish, redfish, trout, salmon. If it's fresh caught, I'll eat that, and that's important. And then I'll eat a good green salad, and that salad has lettuce in it and kale, and it'll have broccoli, and I use olive oil. And then I make sure I get some steamed broccoli or steamed asparagus or something on the side. That's my eating program. And it's kept me in good health. And when I do heart scans, which I recommend that you ought to have a heart scan done if you're above the age of 40 to see if you have any atherosclerosis or hardening of the arteries, which would indicate that you have coronary artery disease. When I check mine, I'm 75. I've got zero plaque buildup in my arteries. And that's because I've been taking my vitamins, I've been taking my hormones, I've been eating healthy over the last 40 years that I've run the Hotze Health and Wellness Center. So that's the story. You want to prevent heart disease, and then the other thing you need to do is do some exercise. Get out and walk. I don't recommend jogging, but I do recommend bicycling, swimming, walking. Those are all very important, so walk a mile or two every day, and that will help keep your cardiovascular function well, and get a good night's sleep. That's very important. Make sure you get 7 to 8 hours of sleep every night. Thank you for joining us today. I hope you find this helpful and you don't get buffaloed into getting placed on statin drugs by the pharmaceutical companies and all their advertisements on TV and by conventional doctors who have been indoctrinated into the whole idea that low cholesterol is going to make you healthy. It doesn't. Thanks so much for joining us today. I'm Dr. Steve Hotze.
Physicians Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.